Nearly 15 years ago, I had a total hip replacement surgery on my right hip. Fortunately, it went great. But wow, the technology has certainly changed and improved since then. In today's Transformation Thursday, orthopedic surgeon Dr. Charles Stewart from Sforzo, Dillingham, and Stewart Orthopedics is here to explain how he uses the robotic-assisted joint replacement. Oh, I can't wait to hear this. Thank you so much for coming.
Thanks for having me.
So how have things changed since I had the old-fashioned hip replacement?
So robotics is the buzzword in orthopedics. It's been transformational for what we can do, particularly in knee replacements, but we're also utilizing it in hip replacements. Many of my hip replacements, more than half of my hip replacements, we're using it particularly for the complex ones, but I tell you, using robotics in my hip replacements has made me a much better hip replacement surgeon because of the detail, because of the information. Everything we glean in knowledge from doing it with the robot has really been transformational at how accurate and precise we can be.
What's going on with that robot? How is that different from the other type surgery?
So the other type surgery, we go in with a very well-defined plan and we've looked at x-rays and it's largely two-dimensional. With the robot, we go in with a three-dimensional plan. We've understood things not just in 2 dimensions, but we've understood things the way they actually operate in 3 dimensions in the real world. And we go in with a plan to specifically adapt the surgery to your own anatomy. Not everybody's anatomy is the same in a knee or in a hip, and we can really tailor that specifically to your anatomy. So this is the best way to do patient-specific functional surgery.
Are there different kinds of robotic systems that could be used?
There is a vast difference between all kinds of different robots that are in the marketplace. There are many robots in the marketplace, and there are many more coming. Some of them are, small, and they're sort of handheld drill type systems, which to me, it's hard to really quantify that as robotics because for me, I want a robot helping me with the surgery. I want to be doing some of the cutting and really tailoring the plan with the software and then be able to translate that into how we do the surgery. And if we can use the saw, use the robot to do the cuts and to do the reaming and to do some of the cutting and the implantation of the components, that's really the most powerful thing. But using the data and the experience of a great robot. I use the Mako robot, which has been the industry leader since the advent of robotics in orthopedics. The Mako robot's been just the best in market. And we're on our 4th generation of robot right now, and wow, they've really transformed from its infancy of just small partial knee replacements to just addressing the whole array of replacements.
Of course, it's still the surgeon that is the main thing you need to consider when you make this decision. How about the patient? What difference does it make for the patient during the surgery?
So during the surgery, the patient, they're getting a tailored surgery that matches their anatomy. And I'm really surprised at how much patients can really feel that precision, feel that accuracy. Getting tolerances down to less than 1 millimeter has really transformed their recovery. The amount of people that walk out of the operating room 2, 3, 4 hours after surgery, the vast majority of all my surgeries these days, they're walking out within a couple of hours.
Wow.
People in their 80s. It's something I didn't think was possible just a couple of years ago. People in their 80s are walking out of the surgery and going home and living independently. They walk into the office, oftentimes 2 weeks out from surgery, no assistive device, no cane, no walker. It's incredible. It's things that we used to never see.
And you make them able to have a very active lifestyle. Nobody in their senior years wants to sit around. You make it possible to do anything you want to.
Yeah, Sarasota is full of amazing aging patients. They want to get back to playing pickleball. They want to get back to playing tennis. Some of them, I was talking to people that wanted to do CrossFit in their 70s and 80s. We're doing box jumps and things like that. We're super agers in this town. I say orthopedic surgeons, we're quality of life doctors. We're all about getting you back to doing whatever it is that you want to do. So, we want to get you living as full of life as you can. I really feel like the precision of the robotics couples very well with these high-demand patients.
Oh, this is wonderful. Thank you so much for all of us seniors. We'll be back on the golf course and in those tennis courts. And you can learn more at SforzoDillingham.com.